Hello family, hello my wonderful people. Thank you so much for chilling in. If this is your first time of coming across my channel, you're so much welcome. My name is IJ as usual, and you are welcome to 𝗷𝘆'𝘀. In this channel I talk about food, I talk about lifestyle, I talk about health matters. Definitely I talk about things that interest me. So subscribe to my channel, please. Subscribe on your right hand corner. That button there is not for fancy. Please subscribe to my channel and turn on your notification bar, so anytime I get to post a new video you will be notified. So today let's talk about VJ infection. VJ infection is a common problem among ladies, among women, so let's not get shy, let's not be shy about that. Should I say 90% of ladies have actually suffered this VJ infection without knowing, maybe they've treated it, or they have it and it went away on its own, or you have it now without knowing. So without further ado, let's get into this video. As I said before, VJ infection, vagina, okay. So VJ infection is a common problem that is being faced by women of all ages, right? Okay, so how do you know that you have a VJ infection? Maybe you have it, maybe your friend have it, someone told you, but actually you don't know that this is VJ infection and you need to treat it. So what are the signs of VJ infection? So if you start experiencing this sign, or someone you know is experiencing it, you should be able to know that this is a VJ infection. The number one sign of VJ infection is itching. Itching down there. It's always itching you, abnormal itching. Normally your body can itch you anytime, but this one is abnormal. Like it's continuous, it's like it's uncomfortable. Like every seconds that place is always itching you. It's abnormal, uncomfortable, unstoppable itching. Every seconds that place is always itching you. So if you are having this uncomfortable itching down there, suspect that you have a yeast infection. Sign is a change in the amount of discharge. Yeah, every lady discharges, mostly during ovulation or any other time, but this discharge, there is increase in the amount, and you notice that is abnormal from the normal discharge you normally have as a lady. And any type of discharge that will cause you to start using sanitary napkin as if you are menstruating, so you should suspect that something is wrong. And this discharge indicates bacterial VJ infection. The next sign is a change in the color of your discharge. The normal color of discharge is a little bit whitish and is odorless, but this discharge comes with blood. This discharge is a kind of yellow or grayish color. No, if you suspect a change in the color of your discharge which deviates from the normal white, and this discharge comes with a lot of odor, so as well suspect a bacterial VJ infection. Another sign of VJ infection is pain during urination or during intercourse. Normally if you are peeing, you're not supposed to experience any pain, or during intercourse you're not supposed to experience any pain as well. But during peeing, like when you want to urinate, or during intercourse, you experience pain, so you should suspect that you have a VJ infection. I mean vaginal infection. The next sign is VJ bleeding. Like you just woke up one morning and you start bleeding. It's abnormal. You only bleed in your period, but if you start experiencing bleeding, like nothing calls for it, so you should suspect a VJ infection. Okay, if you experience all these signs like in your body, suspect that something is abnormal and suspect that place needs help. You have infection. You have serious infection and you need to see a specialist as well, or your doctor. Don't neglect yourself. Don't neglect your VJ if you are experiencing all these signs and symptoms. These signs and symptoms is a cardinal sign of vaginal infection. So let's talk about the risk factors of VJ infection, like causes, things that you do that exposes you to VJ infection. Okay, so VJ infection can actually come through sex, like sexual intercourse. That's when you have sexually transmitted disease. As well, it can come from other causes, from your environment, from poor hygiene, from bacteria, and so the number one cause of VJ infection is moisture. When I mean moisture down there. Like you leave your VJ wet, you go to, or when you have your bowel movement, you leave that place wet. Is not good. Always pat dry that place. Don't always leave that place wet, because this wet area, yeast grows in a wet and moist environment. So the number one cause of VJ infection is moist area. That's moisture, wet area. The next cause is high sugar intake. Like you love sugar, from what you drink, chocolate, biscuits, a lot of sugary foods. Yeast love sugar. Okay, so high sugar intake causes VJ infection. Then the next one is diabetes. Of course, we know that diabetes is sugar also. Then the next one is STD, through sexually transmitted disease. So these are some of the things that can cause VJ infection, that can cause you to have VJ infection. Next cause is antibiotic intake. Like antibiotic is not a drug. Yeah, it's a drug, but some women take antibiotic for no reason. Like some of them have the mindset that taking antibiotic, someone told me already that taking antibiotic cures pimple, like it makes your face to look smooth. Like I don't know the science behind that, but what I'm trying to say, that taking a lot of antibiotics without any reasonable reason or without being prescribed by your doctor can actually expose you to VJ infection. Stop taking antibiotics without being prescribed, without any reasonable reason. That's a drug abuse. Let's talk about prevention of VJ infection. What are the things that you need to do in order to prevent yourself from contacting this VJ infection? VJ infection is not only from sex, it's not only sexually transmitted, it can be environmentally transmitted, poor hygiene transmitted. So what are the things that you need to do as a lady in order to protect yourself from contacting this microorganism that will lead to VJ, vaginal infection? Number one thing that you should do is to clean yourself dry, pat, and avoid moisture down there. As I said before, one of the causes is moisture. So always clean yourself dry and pat yourself. Anytime you pee, after peeing, you clean yourself very well. Anytime you have your bowel movement, you clean yourself very, very well. Don't allow that place to be wet. Even your undies, if you sweat with your undies, always change it. Yeast, bacteria tends to grow in a moist, warm environment. So always pat and dry that place. The next tip is to clean yourself from front to back after peeing or after having your bowel movements. So that's the best way to clean yourself as a lady, from front to back. That's the best way. Avoid tight clothing, tight undies, tight panties. Tight undies, all this tight stuff prevents air going in down there, so you as well increasing your risk of contacting infection. So always change your undies anytime you sweat. I've talked about that one before. If you sweat, change your undies. Bacteria, yeast infection tends to grow in a warm place, warm environment. Reduce your intake of sugary things to reduce your frequency of contacting infection. If you're the type that love sugar, you can't do with sugary things. I love sugar so much. Better reduce it now, okay, so that your frequency of contacting VJ infection can be reduced as well. Avoid harsh soaps, avoid harsh chemicals down there. Avoid douching except it's been prescribed by your doctor for any important reason. Avoid lotions, scents, perfume, this vagina, that some people are using. Avoid it, because all these things contain chemical and it alters the good bacteria down there, thereby increasing your risk of having VJ infection. Wear cotton panties and avoid synthetic undies, avoid synthetic pants in order to allow that place to breathe. That place needs fresh air, okay? So avoid synthetic undies and panties. Always use preventive measures during intercourse. That's for STI related VJ infection. So always use condom in order to prevent your risk of contacting sexually transmitted infection. Okay, take antibiotic only when necessary or is being prescribed by a doctor. Then finally, see a doctor for antibacterial cream or medication. So if you're having all these signs and symptoms and you are experiencing all this, you need to see a doctor. The earlier the better, okay? Don't just sit down there and be confused, or you are shy to talk to someone. All these signs and symptoms indicate that you are having a vaginal infection. So see a doctor, see a gynecologist, or see a specialist for proper care. Have you subscribed, or you are just watching? Please subscribe to my channel. Subscribe, it means a whole lot to me, okay? Comment, like, and subscribe to this video. I love you all. See you in my next video.